My name is Amber Pierce, and I'm a family nurse practitioner in Vail, Oregon. I would like to thank U.S. Senator Ron Wyden and Oregon U.S. Representative Greg Walden for their support of family nurse practitioners practicing at the top of our scope, especially in rural underserved areas. We appreciate being fully integrated into the healthcare delivery system. I would like to ask you to take a moment to think about a friend or a family member with bad lungs, who coughs a lot, produces sputum, has activity intolerance, shortness of breath, or struggles to breathe. This is chronic obstructive pulmonary disease, or COPD. This horrific lung disease affects 15 million Americans, causes 3 million deaths annually, and is the third leading cause of death in our country. We can make life better for patients with pulmonary disease by accessing pulmonary rehabilitation services, but our Oregon residents face several challenges in accessing pulmonary rehabilitation, which is the leading treatment to improve not just the length of life, but the quality of their life. Current federal law requires pulmonary rehabilitation to be ordered and supervised by physicians. There is a shortage of physicians across all geographic areas of our state, and it's worse in the rural areas. This shortage makes it very difficult for patients to receive pulmonary rehabilitation, as there may not be a physician in their town or city to order or supervise these services. Currently, only 3% of Medicare patients with chronic obstructive pulmonary disease receive pulmonary rehabilitation services. Research shows pulmonary rehabilitation improves people's physical, psychological, and social functioning. It improves patient outcomes, reduces burden of disease, and reduces healthcare costs overall. In 2018, Congress passed the Bipartisan Budget Act, which authorizes physician's assistants and nurse practitioners to supervise pulmonary rehabilitation services beginning in 2024. However, nurse practitioners remain unable to order such life-saving services for their patients, and supervising this care is still 4 years away. In an effort to ensure timely access to life-saving services such as pulmonary rehabilitation, this barrier to care should be revised to allow all primary care providers to order the needed services from their clinics. Your support of the Cardiac Rehabilitation Care Act of 2019 could facilitate faster resolve of the Bipartisan Budget Acts authorizing physician's assistants and nurse practitioners to supervise cardiac and pulmonary rehabilitation care, with an implementation date moved from 2024 to 2020. This becomes especially important given the current COVID-19 pandemic, which is affecting pulmonary function and resulting in pulmonary fibrosis, or hardening of the lung tissues. Direct physician supervision for pulmonary rehabilitation services should be expanded to include primary care providers, as the current workforce is overworked and under intense strain. Because I care deeply for my patients, I, along with the American Association of Nurse Practitioners, ask you to co-sponsor H.R. 3911 S. 2842, the Increasing Access to Quality Cardiac Rehabilitation Care Act of 2019. Thank you for your time and consideration in strengthening America's everyday hero workforce.